Local complications. Infiltration occurs when IV fluid leaks into surrounding tissues. It occurs when the venous access device punctures the vein wall or migrates out of the vein. Infiltration is more likely to occur 1 or more days later, usually because the flexible tip of the catheter has penetrated the vein wall. Signs and symptoms may include one or all of the following: swelling, blanching, discomfort or burning, tightness, cool skin around the site, and absent of backflow of blood. Nursing interventions include stop infusion and remove device, elevate the limb, check pulse and capillary refill, notify practitioner, restart the IV and infusion, preferably in another limb or above the infiltration site, document condition, interventions, and check the site frequently. Phlebitis is inflammation of a vein. Because many elderly patients have fragile veins, they are more prone to phlebitis and infiltration. Phlebitis may be associated with medications that are acidic, alkaline, or have high osmolarity, vein trauma during insertion, vein is too small, vascular access is too large, or prolonged use. Usually develops 2 to 3 days following exposure to medications or solution. Signs and symptoms include tenderness, redness, puffy area over vein, elevated temperature, vein is hard on palpation. Nursing interventions include stop the infusion and remove the device, notify the practitioner, apply warm packs as ordered, restart infusion in another vein, and document. Occlusion is blockage that prevents the ability to infuse fluids or flush a vein due to the accumulation of blood materials, fibrin, platelets, or incompatible infusant that causes crystallization in the lumen of the infusion device or vein. Signs and symptoms include no increase in flow rate when IV container is raised, blood backs up into the IV line, discomfort at insertion site. Preventions include flush promptly after intermittent piggyback administration, arm below heart level when walking, and maintain IV flow rate. Nursing interventions include use a low flush pressure syringe during injection, don't use force. If resistance is met, stop, reinsert IV device if unsuccessful, and document. Severed or fractured catheter. Signs and symptoms include leakage from the catheter shaft. Prevention. Never reinsert needle into catheter. Remove the unsuccessful inserted catheter and needle together. Nursing interventions. If the broken part is visible, attempt to retrieve it. If unsuccessful, notify the physician. If a portion of the catheter enters the bloodstream, place a tourniquet above the IV site to avoid progression. Notify the physician and document. Hematoma is a bruising at a venipuncture site as a result of bleeding in the area. Signs and symptoms include tenderness, bruising, inability to advance or flush IV line. Prevention. Choose a vein that can accommodate the size of the intended device. Release the tourniquet as soon as successful insertion is achieved. Nursing interventions. Remove the device, apply pressure, apply warm compress as ordered, recheck for bleeding, and document. Venous spasm. Possible causes include severe vein irritation of irritating drugs or fluid, administration of cold fluids or blood, very rapid flow rate with fluids at room temperature. Possible signs and symptoms include pain along the vein, sluggish flow rate when clamp is completely open, and blanched skin over the vein. Nursing interventions include apply warm compresses as ordered, slow the flow rate, and document. Thrombosis. Possible causes include injury to endothelial cells of vein wall, allowing platelets to adhere and thrombosis to form. Signs and symptoms include painful, reddened, and swollen vein, sluggish or stopped IV fluids. In order to prevent thrombosis from occurring, use proper venipuncture techniques to reduce injury to the vein. Nursing interventions include remove the device, restart the infusion in the opposite limb, apply warm compresses as ordered by the physician, watch for IV therapy related infection. Do not rub or massage the area, and document. Remember, thrombi provide an excellent environment for bacterial growth. Thrombophlebitis is the inflammation of the vein due to the formation of a blood clot. Possible causes, thrombosis and inflammation. Signs and symptoms include severe discomfort, reddened, swollen, and hardened vein. Prevention includes check the site frequently, remove the device at the first sign of redness and tenderness. Nursing interventions include remove the device, restart the infusion in the opposite limb, apply warm compresses as ordered, notify the physician, watch IV therapy-related infection, and document. Remember, thrombi provide an excellent environment for bacterial growth. Nerve, tendon, or ligament damage. Signs and symptoms include extreme pain, somewhat similar to electric shock when the nerve is contacted, numbness and muscle contraction, delayed effects including paralysis, numbness, and deformity. Possible causes, improper venipuncture technique resulting in injury to surrounding nerves, tendons, or ligaments, tight taping or improper splinting with arm board. Preventions. Don't repeatedly penetrate tissues with the venous access device. Don't apply excessive pressure when taping or encircling the limb with tape. Pad the arm board, and if possible, pad the tape securing the arm board. Nursing interventions. Stop the procedure and remove the device, and document.